Hey, everyone at Hospital Sultan Idris Shah Serdang. Look, I get it. After a crazy long shift, the last thing you want to think about is documentation. It feels like such a drag, right? But what if I told you that your notes are actually one of the most powerful tools you have? Seriously, stick with me for a few minutes and I promise you'll see your clinical notes in a whole new light.
Yeah, we've all been there, staring at that mountain of paperwork. It's so easy to just see it as a box you have to tick, right? Just another necessary evil to get through before you can finally go home? It's a totally fair question, and I bet it's crossed your mind a time or two.
But here at HSSI's, the answer is a big, fat no. Your documentation is so much more than just a note. It's actually the first critical step in this massive data pipeline. Let's dig into how the words you jot down on a page actually transform into vital resources for our entire hospital.
Okay, so think about it this way. Every single diagnosis you document, it doesn't just sit in a patient file. Nope, it becomes the first building block for our hospital's data. It directly impacts our Casemix funding, yeah, the money stuff. It fuels crucial research, and it even gets reported nationally. What you write down in the ward, it has this huge ripple effect.
So with ICD-11, the game has changed a little bit. It's all about telling the whole story now. There's a technical term for it, post-coordination. But honestly, that's just a fancy way of saying we need to combine multiple little pieces of info to paint one big, clear picture of what happened to our patient.
And you know what the best part is? You don't have to learn a single code. You are not expected to be an ICD-11 expert. Your job is to do what you already do best. Be a clinical detective. Just tell the complete story with all the clear, specific details. And you're basically handing your coder all the clues they need to solve the case perfectly.
Seriously, if you only remember one thing today, please let it be this simple formula. The nature of the injury plus the cause of the injury equals the complete story. That's it. Get both sides of that equation right, and bam, you've just unlocked perfect documentation.
All right, to make this even easier, let's keep our detective hats on. We're going to follow two simple rules to make sure we uncover that full picture for every single injury case. Let's break them down.
Okay, rule number 1 is all about the what, as in what is the injury? We need to be super specific here. First, where is it? Give me the anatomical site and the laterality. Is it left or right? Second, what type of injury is it? A closed fracture, a deep laceration, a full thickness burn? And third, how bad is it? Tell us about the severity and any complications, like if it's an open fracture or if there's any neurovascular compromise.
And that brings us to rule number 2, the why. How in the world did this happen? Again, we're going to ask 3 key questions. First, what was the intent? Was it unintentional? Was it an assault? Or was it self-harm? Second, what was the mechanism? A fall, a car collision, a chemical splash. And finally, what was the context? Where were they? And what were they doing when it happened?
Okay, let's put it all together and see how these 2 rules create a masterpiece. Look at this example right here. It perfectly captures the nature of the injury, a closed fracture of the shaft of the left femur. And it nails the cause, an unintentional fall from a ladder while performing maintenance work at a construction site. A simple sentence like this, it's absolute gold for a coder. It gives them everything they need, no questions asked.
All right, so we've got the basics down. Now let's dive into some of the trickier, more complex situations. The kinds of cases we see all the time right here in the wards of Hospital Sultan Idris Shah, Serdang.
When we're dealing with really sensitive cases like intentional self-harm, using precise, non-judgmental language is absolutely critical. So instead of just writing overdose, we need to be much more specific. Something like intentional self-poisoning with 40 tablets of paracetamol. See how that documents the method, the intent, and the substance? That's the complete, necessary story.
Now, what about healthcare-related harm? This is another area where we have to be incredibly precise. We need to establish a really clear causal link. Just follow this simple 3-part model. First, state the harm. What happened? Second, identify the cause or the source. Was it a procedure, a drug, a device? And third, describe the mechanism. How did it happen? And this is key. You have to use causal words like due to or secondary to. Just saying something happened after surgery is way too vague. It just doesn't cut it.
Okay, take a look at these 2. On the left, you've got a pretty common note, post-op bleed, short, to the point. But look at the one on the right. It tells the whole story. Post-operative hemorrhage due to surgical fixation of fractured neck of femur. One is just a label, right? The other is a complete narrative.
Okay, here are a few more rapid-fire tips for you. For any poisoning, you always have to name the substance. For adverse drug effects, make sure you link the harm directly to the drug using those causal words we just talked about. And for sequelae, late effects, you have to explicitly state that the current condition, like say chronic pain, is a late effect of a specific past injury. Getting this right is absolutely vital for correct classification.
How often have you seen a patient with a condition that seems to pop up out of nowhere, only to find out it's actually the ghost of an old injury? Well, today we're going to break down how to properly document that connection, how to link a patient's current problem to something that happened months or maybe even years ago.
We've all been there, right? A patient comes in with a problem, and the real root cause isn't something new. It's the lasting consequence of something old. So, how do we capture that? How do we make sure the medical record tells the full story?
The key to all of this is understanding one specific concept. I like to think of it as the injury's echo, that lingering effect that just keeps going long after the original event is over. Now, the clinical term for this is sequela. So, what exactly is a sequela? Well, the official definition is a condition that's the consequence of a previous injury. But here's the part you really got to remember. The original, acute condition is no longer present. It's done. It's healed. What we're dealing with now is the after effect, the late effect.
Think of it like this. On one side, you have the past. That's the original event. It's long over. On the other side, you have the present, what the patient is dealing with today. Our job as clinicians is to build that narrative bridge right between the two.
All right, let's see how this actually works in a real-world scenario. We're going to start with a classic physical injury, the kind of thing you'd probably see in orthopedics or rehab.
Okay, picture this. A patient walks into your clinic. They've got this noticeable stiffness, a contracture of their Achilles tendon. And when you dig into their history, you find out they had a really bad tendon injury years and years ago. The acute injury is totally healed, but this stiffness, this is what they live with now.
So, how do we document this? It's a simple phrase, but it is incredibly powerful. You just state the current problem, the contracture of Achilles tendon, and then you link it by saying it's a late effect of previous tendon injury. Boom, done.
Let's break that down. The current manifestation is that contracture. The original event is the old tendon injury, which, for coding, falls under Chapter 22. But the absolute key here is that linking phrase, late effect of. That's what forges the undeniable connection between the past and the present.
Great. Now let's switch gears a bit. We're going to go from a physical injury to a neurological one. The same principle applies, but the context is obviously a little different.
So for this case, imagine a patient comes in with persistent headaches, maybe some subtle cognitive issues they've been noticing. And it turns out, years ago, they sustained a head injury. Again, that initial trauma is long gone, but these residual effects are impacting their life today.
The documentation follows a really similar pattern. You can state head injury sequela, which right away tells you what's going on, and then clarify it with residual effects of previous head trauma. It's clear, it's concise, and it tells the whole story. Breaking this down, you see the exact same structure, right? The manifestation is the head injury sequelae. The original cause is the previous head trauma, another one from Chapter 22. And that link is made crystal clear with residual effects of. It's also worth noting, some systems even let you add an optional cause of late effect tag, which makes the connection even more obvious for coders.
So why does mastering this really matter so much? Why are we focusing on this? Because it's about way more than just coding correctly. It's about telling the patient's complete coherent story.
And that's the crucial point. When you document a sequela the right way, you are creating that narrative bridge we talked about. You are directly connecting today's clinical problem to yesterday's event. And that provides context that is absolutely essential for continuity of care and accurate clinical coding.